Oh, good afternoon to everybody, and welcome to our midweek update on COVID on the 2nd of March. Let me start my screen. And yeah, so certainly COVID has slipped out from under the media coverage radar, sadly largely replaced by the tragic events in the Ukraine. But coming back to COVID, there's really not a great deal to report on since last week and the week before and the week before that. We're still kind of grumbling on at a low level, 1 to 2,000 cases and a few deaths. In fact, yesterday, for the previous 24 hours, there were no deaths to report. So we really are at a pretty kind of low level. And I've shown this kind of graph hasn't really changed very much from the past couple of weeks. We still, this is a little bit old, but same thing, the epidemic curve is still a little bit above the interwave baseline level, grumbling on for various reasons, as I mentioned previously. And largely from the Gauteng province has really kind of kept it from sinking down to the interwave level. In terms of the Hatola data, starting to plateau a bit, starting to start to come down, but still a little bit high though. As I said, about 4 times what it was about a month ago, 5 weeks ago. But the Gerrit Kadisha report, interesting enough, that COVID really has hit the Jewish community pretty hard. There was a 39% increase of the expected mortality, probably largely due to COVID. So it has been quite serious in the Jewish community. In terms of vaccination, a little bit of improvement. It's gone from 50,000 to 60,000 to 80,000 to 100,000 doses administered in the last 24 hours. I think this is probably due to the slight change of legislation in terms of the interval of vaccination and also the ability to mix and match vaccines, what we call the heterologous boosting, as I discussed previously. I think this is probably to a large extent slightly picked up the vaccine coverage. There's been a little bit of improvement from 60% to 62%, 61.8% of the 60 plus years individuals who've been fully vaccinated. 68% have at least had one dose. So there is still a bit of a gap, but at least we are starting to move in that direction. And hopefully these new kind of changes might accelerate vaccination coverage. And worldwide, there's also has been a reduction of cases throughout the world. So Omicron has really been hailed to some extent and in some quarters as relatively good news. Relatively good news because even though there has been some evolutionary changes and the evolution of subvariants of Omicron, I spoke about this before. The main one we had was BA.1. And now there's BA.2, which has now replaced BA.1, seems to be a more fit virus. But hopefully, thankfully, the vaccination coverage or the immunity coverage from BA.1 seems to be pretty good against BA.2. So a lot of what's happening with Omicron does look fairly favorable. It's interesting because this article, this editorial appeared in The Lancet quite recently, about 6 weeks ago, where they're starting to look at Omicron as perhaps the beginning of the end of the pandemic. Now, this is not a universal feeling, but I'll just dwell on it for a little while. Omicron really has got 2 favorable characteristics or properties. One, that has spread very widely and therefore immunized, natural immunity, a large number of individuals. And second of all, while it's done so, it's done that at a relatively minimal cost because most individuals, a great majority, have had it relatively mildly or mainly, in fact, even asymptomatically. And this is an interesting editorial. They've estimated, in fact, they've calculated, or calculate for models, that about 125 million there were 125 million Omicron infections at the peak, about middle of January of this year, at the peak of the Omicron epidemic. 125 million Omicron infections, very, very extensive. And I think we kind of feel it in South Africa as well. And interesting enough, this is probably immunized, natural immunity, at least 50% of the world's population, if not more now. And in South Africa, in fact, it's estimated that about 90% of the infections were asymptomatic. So it's widespread infection of a virus which is causing relatively mild, or in fact, often, mainly asymptomatic infections. In fact, people that enrolled for a clinical trial, 31%, nearly a third of them, were already they came to the trial completely healthy, no symptoms, and they were found to be positive. So the media has been there's been a lot of kind of publicity, both in the lay media as well as in the scientific medical literature, Nature, for example. Is Omicron the kind of the herald, the start of the end of the pandemic? Some media have really jumped the concept that the pandemic is over. This is certainly not true. But is Omicron now starting to be a sort of a sign that the pandemic might start to be winding down? And what's often touted as this term endemic. Is the COVID, the SARS-CoV-2 pandemic, now starting to become endemic? And just to revise what I mentioned a couple of weeks ago, different what we mean by endemic. If you recall, I spoke about the reproductive number and this magic figure of 1 over here. If the reproductive number, the R number, is at a level of 1, it means that the infections are not expanding. They're kind of entrenched in the population, but not expanding. The moment that the R value exceeds 1, that means that the infection is spreading, is expanding, and then it becomes an epidemic. So if it's sustained for long periods of time, as many viruses are in the human population, we call them endemic infections. Endemic infections occasionally do have epidemic outbursts, but we normally would call them an endemic infection if it's at a sustained level below this R value of 1. If it spreads around the world, then we'd call the epidemic a pandemic. And just to kind of bring it into where we are with the coronaviruses, we have endemic coronaviruses. These have been with us for millennia. And these are human viruses entrenched in the human population. There are 4 of them causing mild upper respiratory infections, the common cold, or mild gastrointestinal infections, and upset tummy. And that's about it. We kind of don't pay too much of attention to it. We can tolerate it very, very comfortably. Then we have the viruses which are introduced from animal sources into the human population. The original SARS in 2003, the Middle Eastern Respiratory Syndrome in 2012, and 2019 SARS-CoV-2, where we are now. So what we're hoping is that SARS-CoV-2, our present cause of COVID, is now becoming a humanized virus, and so will, in fact, eventually then become an endemic coronavirus. So this is what many people are saying. Are we now coming to the end of the pandemic with SARS-CoV-2 becoming an endemic, tolerable, mild cold, mild upper respiratory infection virus? As you know, the government, the state of disaster, is probably going to come to an end pretty soon. But must remember that some restrictions, and particularly like mask restrictions in indoor environments, crowding legislation and restrictions, will probably still remain. It'll go from COGTA, which is now at the moment managing the state of disaster, to the Department of Health under the National Health Act. And it's really masks, I think, which people are now kind of, I think, becoming very lax about. And I think we can see it in our South African environment very much so. And just to emphasize again, wearing a mask under the nose is as useful as not wearing a mask at all, because you're still generating your infectious droplets and aerosols and so on. And so it's interesting that parents seem to be very, very sensitive about their children wearing masks. And again, just to emphasize that there is really no scientific medical evidence that wearing masks, even for a prolonged period of time, is harmful to children, or is harmful to adults, is harmful to anybody. You don't rebreathe the air, which can be harmful. That is just simply not true. There's no scientific evidence for it, and there's no harm in children wearing. In fact, many children, most children, the great majority of children, seem to kind of tolerate wearing masks maybe even better than their adult parents. So why continue with restrictions? And what I want to do, in fact, in the rest of this talk, is talk about why we still do need restrictions and what is the place of restrictions still going forward till, in fact, we come to the real end of the pandemic. And next week, I'll deal with why do we still need vaccination. And then the following week, I'm going to talk about understanding risk. So let's come back to why restrictions. Now, the idea of abolishing restrictions and letting the natural immunity from infection provide immunity to the population is not totally new. In fact, this was actually started in 2020 in the pre-vaccine era, in the middle of the 2020s, by these three very prominent scientists, Dr. Martin Kulldorff, professor at Harvard University, Professor Gupta, professor at University of Oxford, and Professor Bhattacharya, a professor in Stanford. Three prominent individuals. They got together and they formed this consortium, and they got together in a place called Barrington in Rhode Island, in the United States. And they drafted this Barrington Declaration. They corrected over 1 million signatures, in fact, when they propagated the idea that if you let the virus, and remember, this is in the 2020, mid to latter part of the 2020s, before the vaccine era, let the virus do the immunizing. Let the virus provide natural immunity, because the great majority of people either get the infection asymptomatically or mildly, and then try and protect or shelter the vulnerable, the elderly and people who've got underlying illnesses. Protect them, but let the virus circulate. So no masks, no restrictions, let the virus circulate and immunize. This wasn't really adopted very widely, except in one country. There's one country which did try it out, and that was Sweden. Sweden tried it out for a couple of months, but at a great cost. In fact, the king of Sweden, after this, actually apologized to the nation. It's simply that we have failed. He lambasted this experiment. Many people have died. In fact, 5 to 10-fold the mortality of neighboring equivalent Scandinavian countries. It's the Swedish people who have suffered enormous under difficult circumstances. Unfortunately, it's frightening to talk about. But this was the pre-vaccine era, where really the only way of getting immunity was by natural immunity. Now, fast forward to the vaccine era, and there are some countries, many countries, as I think I mentioned before, which now have lifted most of the restrictions. Masks are not widely used, are not widely worn at all. Social events are taking place, crowding is taking place. In fact, Denmark is one example. The Prime Minister, I think I mentioned in the previous talk, welcomed completely open Denmark. And the result of that, in fact, was this steep increase in cases. And this was repeated in many other countries, in Israel, even in New Zealand, which up to now had been almost COVID-free. They had saying less than 250 cases prior to the Omicron variant. Now they thought with the Omicron variant, we can open up a bit, and now shot up to just under 20,000 cases per day. Japan also was very effective in controlling its infection, but even its mortality rose, not only the number of cases, but mortality as well. And just to emphasize the point that Omicron is not totally a benign disease. In fact, Hong Kong currently, they are slightly improved now, but currently are suffering under Omicron. And in fact, the picture in Hong Kong now is reminiscent of the pre-vaccine era in Italy, for example, where the hospitals were overwhelmed, the mortuaries were overwhelmed. And in fact, the CDC did this calculation, the price of freedom. In other words, freedom from restrictions, what it costs in terms of mortality. And they're comparing the United States to Canada, which did retain most of the restrictions, the mask mandates, and so on and so forth, and comparing the mortality relative to population of the United States as compared to Canada. That is the difference if we do dispense with restrictions or if we keep restrictions. And again, just to emphasize the efficacy of wearing masks, this is a recent study published from the Center for Disease Control in the United States, where they showed even a cloth mask, 56% effectiveness in preventing infection. Surgical masks, which is the one that we do generally recommend, 66%. The respirators, the K95 or N95, not easily obtainable, obviously very effective in preventing infection. So masks are certainly very effective and should really, we still do need to keep the mask restriction for some time yet. This is an interesting study just to emphasize this, again published quite recently, where they actually did a study, it was done in fact in May, in a mass indoor gathering at a musical concert in Paris, where they actually looked at people that came to this concert versus people that didn't come to the concert. And I won't go through all the statistics, but basically what they found, that participation in this large indoor live gathering without physical distancing, obviously, was not associated with increased cell size, but this is the important thing, provided a comprehensive preventive intervention was implemented. And the great majority, 88%, were very strict with wearing masks. There was antigen, rapid testing beforehand, and provided one kept with these restrictions, then in fact, even a mass gathering proved to be relatively safe. So I'll leave it there. And next week, I'll handle why vaccinate in this era of Omicron, where we have widespread natural immunity. So I'll leave that and I'll come to, there was one question which came, an interesting question, practical question. Individual who did respond poorly to the vaccine, he or she, I'm not quite sure the question was, had a stiff arm after the first vaccination. After the second vaccination, had again a stiff arm, which I think many people, if not the majority, do have tenderness for a day or two afterwards at the injection site. This is the inflammatory response against the vaccine, which is part of generating the immunity. But on the second vaccine, also had flu symptoms, which also many people do get, a feeling of that flu feeling, maybe muscle aches, maybe even a low-grade temperature. And there's no problem, no harm in taking a Panado or taking an aspirin. It's not going to interfere with the immune response, and it's going to make you feel more comfortable. By all means, you can treat it. In fact, this person actually had a third vaccination and then had the allergic response, came out in bumps and a kind of sunburn feeling on the back. Now, a number of people do get an allergic response at the injection site, particularly with the Pfizer vaccine, less so than with the Johnson & Johnson vaccine. Now, if somebody does have an allergic response, there have been now a number of studies, and it's been studied quite intensively. It doesn't preclude getting vaccination again, and one certainly should. However, if you do have a moderately severe reaction, it is probably better to go for the alternate vaccine. So if you had Pfizer up to now, choose Johnson & Johnson, and the opposite would apply as well. If you had Johnson & Johnson, then choose Pfizer. But there's not a reason not to be vaccinated. I think I've mentioned in a number of occasions before, it is wise to alert the vaccination site that you have had a response, so at least they're aware of it. All the vaccination sites do carry emergency equipment for a severe allergic response, which I must underline is very, very rare. It's of the order of about a few, 4 to 5 to 10 per million vaccination doses, mainly with Pfizer, less so Johnson & Johnson, very rare. But it is a wise precaution to at least alert them. And if you have had an allergic response, I think a few allergics out the injection sites is not, I'm talking about allergic response throughout the body. then it's wise to alert the vaccination site and stay behind for at least 30 minutes, not the usual 15 minutes, so that if the unusual circumstance you do have an allergic response, it can be treated. But again, I emphasize it is rare. So let me leave it there. And again, I wish you all keep well, keep safe, and we'll see you next week. All the best.